Greetings, everybody. My name is Chris Donovan. I'm a partner at Foley Lardner in our Boston office. I'm a healthcare transactional lawyer, and I'm joined today here at the conference with Laura Verino, who's a partner at Optum Ventures. And obviously, lots of funding going on in behavioral health. Some interesting developments recently, and we're here to, at least over the next 30 minutes, discuss some of the trends in both investment and M&A and some of the developments that we think might occur over the next 12 months. So Laura, delighted to have you here with me today, and excited about our discussion. And maybe I'll turn it over to you to introduce yourself and a little bit about Optum Ventures.
Great. Extremely excited to be here, and thanks for the tee up, Chris. So to introduce myself quickly, Laura Verino, managing partner with Optum Ventures. I've been here since the firm was founded about 5 years ago. Kind of like to say that I've been on every side of the innovation equation. I started in the startup space, spent a bunch of time with incumbents, and then found my way to the investment side. And where I sit now is kind of best of all worlds from my perspective, kind of right in between the greatest entrepreneurs from a very biased perspective in our portfolio, and then one of the largest incumbents in the space in United Health Group, and kind of get to play that fun role in between the two, helping them better work together, and picks up on a lot of the best parts of my previous roles on all those different sides of the equation. I'll talk a little bit about Optum Ventures, Chris, if that works, just to give people that context before we jump into some of the questions.
Absolutely, Laura. Go ahead.
Great. So Optum Ventures, like I said, founded 5 years ago, and really because of a recognition that a lot of interesting innovation was starting to skew earlier, and we needed a more comprehensive and strategic way to look at that innovation, both from an investment perspective and from a partnership perspective across the United Health Group. So we sit as a venture capital fund, manage just over $1 billion, and invest on behalf of United Health Group, stage agnostically across the ecosystem. We really are looking for those opportunities where we believe in the companies, the teams, the thesis, and the categories that we're looking at, and believe that we can actually provide differentiated value to those companies. And those are kind of the perfect opportunities for us. That differentiated value can be anything that sort of taps on our broad healthcare expertise. And that's really what we're trying to infuse into the ecosystem. So sometimes that means just bringing that sort of strategic expertise to the table. Oftentimes it means leveraging some of our relationships and commercial know-how to help our companies scale more broadly. We have about 56 companies in the portfolio at this point, and we have been quite active in the behavioral space since 2017, when there were a lot fewer companies, as I'm sure we'll get into in the category. We have, I think, over 10 companies in the behavioral space today. So that commitment to the space started way back in 2017, and we've been hyper focused on it since.
Fabulous. Thank you, Laura. Yeah, no, I'm looking before we got on at the number of investments you've made in behavioral health. You were certainly one of the pioneers in the space and one of the leading investment firms. I think we've got 2 or 3 portfolio companies we work with that Optum is an investor in. Just stepping back for a second and maybe going back to 2017 and bringing it forward. There's been an enormous amount of capital with some really huge rounds going into behavioral health startups. I hate to even use the word startup now, but with big valuations, big news, and we're, I wouldn't say teetering on a recession by any chance, but a little bit of a shakeout in the public markets. I'm kind of getting the sense maybe that we're turning a corner a little bit with investment trends in behavioral health, and investors may now be looking at valuations a little more carefully. They may be requiring some of their portfolio companies to focus a little bit more on profitability, or at least trying to achieve profitability. But I'm kind of curious what your view as an investor is in where we might be going forward. Do you think there will continue to be significant investment rounds going into these companies, or do you think we might be at the point of hitting the pause button and trying to rationalize to some extent the P&L of some of these companies?
Yeah, it's a timely question and a great question. And I think in my head goes exactly where yours does, back to that first phase of 2017 and the first wave of innovation, at least in this era in the behavioral space, and thinking about that as the basis of like, how did we get where we got to during COVID and at this moment right now? So maybe to start with that 2017 point that you called out, I think for us, we looked at the broad space and the broad areas where we might invest, and noticed, as I think many others did, that the behavioral space had quite literally been carved out from innovation. The way that the actual industry is actually structured as a carve out is almost the same as what we saw in terms of innovation not hitting the behavioral side the same way it was hitting the physical side or medical side, or however you want to look at it. And we saw a big opportunity in 2017. But we could count most of the companies. I think we could probably recite most of the companies that existed at that moment. It was Ginger, it was Lyra, it was Lantern, Talkspace, maybe a few others, Quartet, that were in slightly different spaces tangentially to some of those adult players. And seemingly since that time frame, there has been such an acceleration of funding, to your point, and focus on the behavioral category, I think in part because of the public health outcries and the consumer demands, in part because of the broad recognition of the importance of behavioral to the broader holistic healthcare ecosystem overall. And so what we've kind of watched happen is the creation of almost an entire sector in itself, where not just one solution covers behavioral the way that it might have been thought of historically, but there's, companies focused on pediatrics and companies focused on high cost areas like substance use disorder or eating disorders or OCD. And we've watched this sort of creation and emergence of an entire sector, in my opinion, of behavioral that can be invested in broadly and kind of not a one size fits all solution across the whole category. But with that has come a lot of saturation, I think, in the space. And throughout the last couple of years, if you need an adult-focused behavioral company, there is the V1 of solutions that I just mentioned. There's also V2 and V3, and sort of choose your own adventure on that side. You need a pediatric solution. There's, sort of category leaders in that space. And then a lot of companies in the last couple of years who emerged and got significant funding. Eating disorders, we have a company called Equip in our portfolio. As soon as somebody starts doing well in some of these categories, then you start to see more companies starting to come into these spaces. So you have sort of saturation, I think, in most of the verticals that we would see within the behavioral space as that sort of emergence of the category has really matured. I love that innovation, and I love the push on the needs, and I love the recognition of specialized models being needed for different populations in the space. But I think what it has caused is kind of a total confusion and fatigue for a lot of the buyers in the space on the healthcare side. And I think folks hear that in a bunch of different ways: HR buyers, employers, payers. I think what is desired and what is wanted right now is a bit of a simplification of how to evaluate and how to select and how to work with these companies, both from a buyer perspective and ultimately from an end consumer experience perspective as well. And I think that's what we're hearing very, very clearly in the market right now. So to your actual question, what I think that happens as a result of that is, and especially with the market turning the way it has, I think there's going to be a clear, necessary focus on what the differentiation is between these different types of solutions. And with that, I think comes an additional burden on companies to not just be broadly expanding access in a way that's not clearly differentiated by your peers or competitors in the space, but also focused on outcomes and whatever sort of differentiation it is that you think you provide in the space that leads your solution to look different than others in the category, to help with some of that confusion and selection of what the difference between a lot of these different vendors are. And I think the consolidation question and some of the other questions below the surface, I think with that higher bar of expectations being out there in the market, I think what we'll start to see is some rise to the top. Some companies continue to be sort of deemed sort of category winners in these different areas like adult solutions, EAP solutions, pediatric solutions, eating disorder solutions. I think we continue to see a lot of funding go into those companies as the platforms in some of these different categories. But I think we do start to see, in addition to that, consolidation in a bunch of different ways. And I think it could take the form of could take the form of maybe a financial sponsor bringing together broad solutions to create a comprehensive platform, somewhat similar to, say, Headspace and Ginger starting to come together and create something interesting there. It could take the form of incumbents getting more involved on the care delivery side from a behavioral perspective. It could even take a form of not being behavioral specific, but frankly, and thinking about conditions across the board as a more simplified experience on the commercial side or in other areas as well. But to me, that's probably what we see is a lot of different forms of consolidation and deeper investment into category leaders and maybe these consolidated entities that can serve as broader platforms instead of sort of a million different solutions that are confusing to the buyers and to the potentially to the end consumers.
Yeah, that makes a lot of sense, Laura. And when you really look at the economic cycle, even though behavioral health is a new sector, what's happened here isn't that different from other investment trends where you have some leading investments and some companies that are kind of market leaders, and eventually there's a rationalization of winners and losers. So, I mean, what you're saying is music to the ears of a healthcare M&A attorney like me, because I agree. I see some consolidate. I see some additional investments, like you're saying, where you really are going to establish some market leaders. And then when you really look at the end customer, be it the payer, the employer, the actual the patient, I do think you're going to see a broader palette of behavioral health offerings, such that you can have more of a full service offering. And as affiliated with a health plan, I'm sure United sees the administrative and the power, the administrative efficiency of that, and the power of that kind of platform and offering for companies who are in the space. Just moving over, getting a little bit more granular. I'm kind of tailwinds and headwinds, kind of a question. When I kind of look at what's happening now with the pandemic, I can see some headwinds coming on the front for behavioral health. For example, if the public health emergency doesn't get extended permanently under legislation, despite the fact that the Biden administration has sort of been moving it along on 60 or 90-day cycles. There's been some kind of high-profile news about employee classification issues and surprise billing and some things like that. I'd say those on the headwind side. On the other side, on the tailwind side, there's certainly a lot of good things happening from the behavioral health side. The real new focus on enforcing the Mental Health Parity Act. And so-called non-quantitative treatment limitations between physical and mental health. I just think, requiring insurers and payers and employers to provide that parity is only good news for behavioral health sponsors. The whole emergence and coordination of primary care and mental health I know United has been a big acquirer of primary care practices up here in Massachusetts, where I live, including my own primary care practice. But certainly a lot of good tailwinds happening there from the standpoint of behavioral health sponsors. And I'm just wondering, looking at your portfolio and maybe outside of it, are there any features that, for example, you would put a little bit more priority on than others in terms of, strategically guiding companies in this space and saying, this is something you really got to get down, therapy, providers and, recruiting and parity or care coordination with primary care. There's so many, as an investor, I'm sure that, you have companies that are like, we're doing this, that, and the other thing. But, I know I'm an angel investor myself, and I know investors want to say, hey, that's all great, but we really want you to focus on these two things and just do this really well. We think this is the way to go. And I'm just wondering strategically if that any kind of conversations you're having with your portcos or just generically internally at Optum Ventures might be interesting to the audience. And I know that's a mouthful I just said, but kind of just where are the key things going forward here that companies should focus on. Maybe that's a simpler way to put it.
Yeah, I'll take it broad, and then I'll think if anything strikes me from like a particular company perspective. I think it's so dependent on a company's situation. We can get into sort of those of our companies that are very virtual, those that are hybrid, those that are clinic models, and the nuances of how those sort of look in this time period. But I'll take it broad first, while in the back of my brain I think about any specific examples. I think for us, when we thought about the innovation cycle, let's just put it that way, on the behavioral side, it was very clear that the first thing that was needed was access and just better access and organization of solutions in this space, because of the clear mismatch of need versus actually ability to get care in the, let's say, 2017 to 2018 time period, 2020 time period. And so when we looked at solutions in the space, as much as we loved the forward-looking, really innovative, different solutions that didn't necessarily leverage a provider or something like that, I think the first thing to us was, okay, first order of business, expanding access to people across the board to behavioral providers or solutions in the space across different areas. I think my biggest suggestion in this time period, and you kind of heard me talk about it in the last question, we're shifting into a moment where it's not just behavioral, I think it's broadly in digital health. There's risk of sort of a view of commoditization, I think, in some of these virtual solutions, if the focus remains only on aggregating a network and not having something really differentiated from some perspective. Maybe that's experience for the consumers or ease of access to care in different ways. Maybe it's very focused on outcomes, which is where our bias kind of is, but we're moving into that phase of a clear differentiation, I think, is needed for these platforms to think about sustainable and scalable ways of existing in the market and ability to create sort of a differentiated platform in the space. So my suggestion in this time period is to really make that shift from a mindset perspective. I don't think the next phase is about just aggregating a broad network of providers agnostically in a virtual way and providing services the way that it might have been a couple of years ago. I think it is very focused on what your differentiation is and your ability to drive, in my opinion, ultimately outcomes that can help you argue for a better position in the market. And when we think about outcomes, I think it's a challenging area in behavioral. We talk about this all the time with our companies because it's not like the physical health side where there is a clear rubric of what outcomes mean or what total cost of care means or the impact of delivering that care. On the behavioral side, it's almost by condition in a really different place, whether you're talking about autism or pediatrics broadly or adult comorbidities and complex patients. And the burden is almost on the companies, I would say, to step up and sort of guide in some ways in partnership with payers and others what outcomes and quality looks like in their subsectors. But I think that the huge opportunity as we think about some of the headwinds that are top of mind for me, which are like contracting, frankly, and the very difficult structure of getting to interesting contracts and sustainable sort of payment structures and things like that. I think that the big potential tailwind in the space is figuring out the outcomes orientation and using that to clearly articulate like the ROI is this and the value for a payer, the value for a physician group or a value for an at-risk entity is XYZ because this is how we actually look at outcomes and our differentiation and the value that we're going to drive into the space. So to me, the biggest challenge probably in the behavioral space, which is also the biggest opportunity, is that focus on quality and outcomes, which is tough for an entrepreneur to drive because it takes a lot of partnership with the ecosystem at large. But to me, that's one of the biggest areas. And I think if you can tell that strong ROI story, whatever it is for your business, then the conversation around getting away from really low fee-for-service contracts and things like that starts to become more possible. And I think helps the ecosystem more broadly.
Makes a lot of sense. And I I do a lot of work with you mentioned SUD companies. And we work with a couple of companies that I think you may know that had the good fortune of actually starting back, like you said, and back in 2017 and have several years, or at least potentially several years of data. And these aren't purely virtual models. These are, sort of hybrid models where there's sort of group therapy and in combination with telemedicine. I'm sure you know who I'm talking about. That I think, like you said, I think it's easier to show, recidivism rates, admission rates, patient satisfaction, in those spaces. When you get up to the kind of the lighter level, more retail behavioral health, for example, the text only companies, I think you're right. I think it, for a payer to, moving outside of purely self-pay, I think the data on that is just harder to prove. But as you said, it's like any other sector of healthcare with value-based care. You have to have the data and the goods to show the payer, the employer, that this is something that's worthwhile. So I think that's a great takeaway for anybody listening. That's a company that is looking to attract attractive rates for their services with health plans.
And one thing just to add in there, I think most companies that you will talk to in this space are eager for that type of partnership and that type of focus with payers or employers or whoever the stakeholder is on the other side of the table, at-risk provider groups. And I think there's a need for the incumbents in the space and those that have the ability to drive some of that along to come to the table as well, because a company can't do all of this on their own as much as they might try on the innovation side. So the breakthroughs that we've seen have been great partnerships, say with Optum Behavioral Health and Equip, or Able to and Aetna or somebody like that. And I think it takes two to actually drive a lot of that along. And while the entrepreneurs need to sort of be focused on it and push that, they need some help on the other side of the table to actually be able to accomplish it.
Music to the ears of those companies. That makes a lot of sense, though. And I think as you said, this is unlike physical health where you can, I don't know, like a knee replacement or something, you can actually quantify, outcomes, if you will. Yeah. It's an area that it is hard to pin down in terms of, what a favorable result is, both from a clinical and financial standpoint. So I agree. Some types of partnerships would be helpful there. Can't just kind of moving over a little bit into a different channel. I can't, obviously Optum Ventures is more of a strategic investor compared to a financial investor. But we've got this whole payvider trend going on now with health plans, either partnering with, or in many cases, just simply acquiring providers, sort of on the theory of, I guess, value-based care and the ability to integrate, payment and provider philosophies. And I know, Optum has been acquiring companies and a lot of other large insurers, Humana, Cigna, you mentioned Aetna. I'm just wondering, do you think in the behavioral health space, you're going to start to see some of that or more of that, like you've seen, for example, in like home health? Been a lot of acquisition. I think United has a pending acquisition there. Humana has acquired. Most of the major insurers have acquired, a footprint there in the home health space. Do you see that and increasingly in primary care, for example? Do you see that happening in behavioral health as well?
I think behavioral is one of the most important sort of frontiers right now across the industry. So I think that, even back to the first question on the consolidation, I think that there is a lot of focus broadly in the market around this area. And I think there's been like a collective experience, let's say during the pandemic, where both from a public health perspective, often folks in the healthcare space seeing from a personal perspective, families, kids, whatever it might be with the conditions we've been in, there's a different view, I think, of the behavioral space now in terms of the importance, the need, and the sort of lack of comprehensive solutions in the space to actually go after some of those pieces. And I think beginning stages of the understanding of the impact of the behavioral health services generally and care on the broader healthcare ecosystem from a cost perspective, from an experience perspective, from a quality perspective. So to me, behavioral for sure is top of mind for, I think, most of those that we see are our companies partner with in the category, whether it's payers across the board or other types of entities, provider groups, to your point. And I think it's going to be a huge focus area, given what we've all collectively sort of watched, witnessed, and I think the commitment to kind of figure out what impact care in this area can have on the ecosystem overall, and on a person, on the whole person overall. And I think we're finally sort of at that point. I do think that sort of outcomes piece that we just talked about is huge in terms of this actually better integrating into the ecosystem overall. If we more clearly understand the sort of quality of solutions in the space and the impact from a ROI perspective, however you sort of define ROI in the space. But what we're seeing right now, not on the sort of full acquisition side or anything like that, but what we're seeing from a partnership perspective is meaningfully different than what we would see 5 years ago across the board, from an incumbent perspective towards the companies that sit in our portfolio. And it's sort of everything from innovative structures like bundled capitated payments. It's things like moving to risk in some ways, or value-based contracts. There's a lot of progress, I think, being made to try and push us along that sort of innovation curve to catch behavioral up with a lot of the innovation that we've seen on the physical health side. I personally don't see that slowing down anytime soon. I think there is a clear sort of focus and understanding on the needs and, frankly, the opportunity in this category.
Makes sense. And it's interesting you mentioned primary care and behavioral health. And I know, you have those two. There's been a lot of investment, in primary care, MA plans, EAP plans, the One Medicals, the Oak Streets, the IORAs, et cetera. Yep. And on the other hand, you have behavioral health, and you have some innovation models coming out of CMMI with coordinated care. And when I kind of look at it, I actually think strategic investors such as Optum Ventures and United are actually pretty uniquely positioned, I would think, to put those pieces together, whether it's an acquisition or a partnership, because I know I see primary care practices expanding, and I see behavioral health, but really integrating those clinically, financially, operationally, I can see being, requiring, some heft and some perspective and some financial clout. And the more you were talking there, just an observation. I think financial investors could do it, but I think, to your point about companies with strategic backers like Optum, that have the perspective to kind of see both sides of behavioral and primary care, I do think probably could add quite a bit of value there. It's an interesting, I think it is. It's an interesting, like, you see a lot of companies obviously go towards the employer go-to-market or payer go-to-market on the employer side with their ASO book or whatever it might be, because I won't say an ease, but there is a certain line of sight to scale and scalability on that side and defined pathways. When you think about the primary care side or just provider side in general, I think the challenge historically, from my perspective, has been like, how do you think about that as a scalable channel if you're a business? And folks like Quartet and a few others have previously tried penetrating that channel. And I think it is one of those still pretty untapped areas in terms of how you think about whether it's an at-risk provider group or fee-for-service primary care group or whatever it might be, how you think about that provider channel and better integration. I think we're just now seeing the collaborative care model actually take off. And frankly, companies that maybe are focused, let's say, on a dependent population, like a eating disorder or pediatric population, starting to think about customer acquisition a little bit different and noticing the relevance of providers in the equation on that side. So we're seeing it bubble up both in the very deliberate collaborative care models, but also in terms of thinking about providers as actually a really interesting partner that might look different than the adult sort of employer channel. It's a really cool time to be in the healthcare business now, whether you're investing or on the legal side like I am. And actually have a daughter that's a lawyer, and I just told her, I said, this is such a dynamic time to be in this business.
Yes.
There's so much change going on. It's fabulous. I know we're coming or have actually exceeded our 30 minutes, but I'll just throw this out maybe as a last question or comment, and just maybe crystal balling where things go in the next 12 months with behavioral health. We've obviously covered a lot of ground here, but any other thoughts about prognostications, trends, things to watch for? I don't sense any slowdown in focus in this area, both from a customer and a payer side. But anyway, I'll just open-ended question if you had anything to add in the crystal ball area.
Yeah, I'm super excited about this time period. I think some of the partners, I think it will force sort of partnerships to be struck in interesting ways that we've already started to see. We talked about the consolidation pieces. I think it's going to organize the category in a way that might be much more impactful from a scale perspective and in a patient or consumer perspective at the end of the day. So I'm extremely excited. I don't think the focus on behavioral is going to slow down at all, but I think the focus in a different way, the focus on sort of category winners and platforms and scalability of solutions and ease of integration across the board, and these are going to be really important in this time frame. And I think that's going to drive the behavioral space even more forward in this time period. So to me, a lot of excitement with my crystal ball about this time period. And I think it's sort of important to be focused on the interesting partnerships and ways of interacting in the ecosystem. And I think there will be a bit of a shakeout, in my opinion, just with where the market is, and also with some of the regulations, like you mentioned earlier, that have made it easier maybe for a lot of companies to scale and in virtual only ways that might get pulled back a bit. So I think there's going to be a healthy and a natural rationalization of companies in the space, but I think it will ultimately allow great solutions and platforms to serve patients better and at scale in the next phase here. So we're pretty excited for it on this side, and grateful for all the entrepreneurs doing the real hard work of actually delivering the care to the patients at the end of the day.
Makes perfect sense. I kind of have to use a baseball metaphor. I kind of feel we've gone through the first 3 or 4 innings, and we're kind of heading into the mid, not quite the 7th inning stretch, but somewhere around there. Yeah. And there, as you say, there are going to be winners and losers, and kind of just a natural shakeout, not a negative thing, but with a maturing sector. These are common things that happen, and I'm totally on board with you. I think the future for behavioral health is definitely bright, and with investors like you and Optum, I think you're going to see it really solidify and mature in the future. So, listen, thank you very much for joining me today, and I really enjoyed your perspectives and views on this. Once again, thank you very much. Appreciate your time today.
Thank you.